Now, in recent years, Australia has had great success in reducing new infection rates for sexually transmitted diseases like HIV and HPV.
Yeah, this might not exactly be the most comfortable conversation to have on a Saturday morning, but it is really important to be aware that while that's the good news, rates of other diseases like gonorrhea and syphilis have skyrocketed. What's going on? To explain, we're joined by Rebecca Guy, who's a professor in epidemiology at the Kirby Institute. Rebecca, thanks for being here. Let's just start with the good stuff, right? How is Australia doing in terms of infection rates of HIV, HPV?
Yeah, so Australia's doing very well with HIV. In the last 5 years, there's been a 20% decline in Australia, so that's pretty unprecedented internationally. And the biggest reduction has been in gay and bisexual men, so there's been a 30% reduction. So we haven't seen declines like that for some time, and reflecting a whole range of different prevention options now are available in Australia. So that is definitely the good news.
Well, it certainly is. I mean, is that all down to the public education? Is that it?
The main things are there's new options now available for prevention. One of the key ones is something called pre-exposure prophylaxis, so it's a bit like oral contraception. People who are at risk of HIV would take tablets every day. It's highly effective and prevents them from getting HIV. So these tablets only became available in the last few years and have been rolled out across Australia, and now it's on the pharmaceutical benefit scheme.
And let's get to the bad news. What are we not doing well?
Yeah, well, it's an interesting time. So we've seen declines in HIV. There's as you mentioned, HPV. So there's a vaccine available, which is reducing HPV, which causes cervical cancer. So that's really important. But on the flip side, we're seeing some increases in other sexually transmitted infections. The most common one is chlamydia, and people may have heard of chlamydia. There's around 250,000 infections in Australia. So today there's probably about 250,000 people out there with chlamydia, and most people don't know they have it. There's no signs or symptoms for most people, and only about a quarter of people will go in and get a test. So that's the most common infection. That hasn't changed very much. It's common, but it's stable. But the two which have increased in the last 5 years has been gonorrhea and syphilis. They were previously pretty uncommon, and now there's been increases in metropolitan areas. And for syphilis, there's been an outbreak in the northern parts of Australia affecting young Aboriginal people. So these are really concerning for Australia because, firstly, most of them don't have symptoms. So what that means is people don't know they have the infection. And chlamydia, for example, you can have it for 1.5 years, and you don't know you've got it, and therefore you only need one sexual partner.
Just to ask a stupid question, if you don't know you've got it and you don't have any symptoms, what's bad about having it?
So it can cause health issues, particularly for women. So if you don't find out you got it and you don't get your treatment, for women the infection can travel. It can cause what's called pelvic inflammatory disease. You get severe abdominal pain, can end up in hospital, can cause infertility. And what we do worry about is pregnant women as well. For pregnant women, it can mean the babies can be born small, prem babies, and also for syphilis, babies can actually die in utero stillbirth. So, and there has been cases of that in Australia, a first world country, and really it can be prevented by a simple test, which is cheap. Just really needs to be offered in pregnancy.
It's quite shocking, really. So what's behind this rise in gonorrhea and in syphilis as well? I read somewhere it's got to do with the dating apps.
There have been reports of that. There isn't data to support that concretely, but it's probably a range of factors. In terms of sexual behaviour, people don't use condoms all the time, people travel more, there's a more sexualised society, and all those things combined. So when you get, I guess, introduction of a strain in Australia, all those factors can mean that the infections keep being passed on within the community. So that the key thing is for people to be aware and to come in to a sexual health clinic or a primary care clinic and get a test done.
And you mentioned that one of the great triumphs in the fight against HIV has been some of these drugs, which are colloquially called PrEP, where you can basically take a daily drug and then you're effectively prevented from, it's almost like a vaccine against HIV as long as you keep taking it. And then on the HPV side, we've also got vaccination rates right up. So essentially we're talking about a pharmaceutical solution to HIV and HPV. But is there the potential that there's a behavioural flip side to that, which is that if you know you can't get HIV or AIDS, you might be less likely to use a condom if you're a young gay guy?
Yeah, it's possible. I wouldn't, though, associate it only with PrEP, I guess, because STIs for gay and bisexual men in Australia have been increasing for 5 or more years, so before PrEP even became available, and it's exactly what you mentioned. There's more options now to prevent HIV, so not only PrEP but other strategies as well. On the flip side...
Without getting too explicit,
Yeah.
other than a condom or PrEP, what other strategies are there?
So treatments now for HIV, for people living with HIV, treatments reduce the virus to undetectable levels, and what the recent data shows is that undetectable level means you can't transmit HIV, so it becomes untransmittable. So therefore, if you were having sex with someone that you didn't that had HIV, you didn't know, the virus would be such low levels it would be untransmittable. So that's another strategy that has been shown in the international literature, which really keeps the virus to low levels in the community. But I think with PrEP, one of the positive aspects of PrEP is when people are coming in to get their PrEP prescriptions, they're also offered a sexual health test. So the highest rates of STI testing in Australia are among gay bisexual men.
Right, it drives people into the
That's
medical
right.
establishment, essentially.
Yeah, so it means there's more testing, which means infections are being detected more quickly. So that's a good part.
So even if you think you're clean, if you're sexually active, go to your doctor and just get all the battery of sexual
All
health
of them
tests
done. Yeah.
It's not
Just
a big deal.
to be clear, just to be safe.
And just to think, I guess, if you think about it, 1 in 20 people within your sexual network may have chlamydia, for example. So you may not feel that you're at risk, but it's hard to work out who is at risk. So it's best just to get a sexual health check.
Thanks, Rebecca. Great to talk to you.
Thank you very much.